Stage 1 rectal cancer means that the cancer has not gone through the second layer of the rectum, which is also called the muscular layer of the rectum. These tumors are very curable by surgery. If the tumor is high enough in the rectum, then it can be removed via an abdominal incision the same way a colon cancer would be removed. If the tumor is lower, sometimes the surgeon cannot remove the tumor through an abdominal incision, and a more extensive operation needs to be performed to be called an abdominoperineal resection, or APR. An APR, by definition, leaves patients with a permanent colostomy and is something we try and avoid if we can, but sometimes cannot be avoided when we're trying to cure the cancer. Select patients with low-lying cancers can be eligible for what is called transanal resection. This is a local procedure for very early rectal cancers which are too low for a standard abdominal operation, which can help a patient avoid an APR and colostomy. Most patients with stage 1 rectal cancer will not require any therapy beyond surgical therapy, although occasionally, if transanal excision is chosen as the surgical therapy, radiation and chemotherapy may be used to make sure that there's no residual cancer after this relatively small surgical procedure. Stage 2 rectal cancer implies that the cancer has gone through the second or muscular layer of the wall of the rectum. And what that means is that there's a chance that cancer cells could have gotten out of the rectum into the surrounding pelvis. If this happens, it leads to what we call local or pelvic recurrence, which is something that we need to avoid because it is very hard to cure once it happens. If combination therapy is recommended, you will also meet a radiation oncologist, as radiation therapy is one of the ways we prevent local recurrence in rectal cancer. As such, many patients with stage 2 rectal cancer receive radiation therapy along with chemotherapy at the same time prior to surgical removal of their cancer. There are advantages to doing the radiation first before surgery that are very important, so it is important that we determine up front whether radiation will be necessary. And the way we determine that is by the types of tests we mentioned before, such as endoscopic ultrasound or MRI. For stage 2 rectal cancer patients, after radiation and chemotherapy have been completed, surgical therapy will need to be done. For many patients, that will involve an abdominal operation. For some patients with very low-lying tumors that are too close to the anal canal or the muscles of the pelvis that control your ability to hold your bowel movements, an APR or abdominal perineal resection may be necessary. This is a surgery where the anal canal itself is removed and a permanent colostomy is formed. Oftentimes, if the tumor is low-lying like this, radiation can shrink it enough that the necessity for an APR is averted, and you can have instead the abdominal operation that would leave normal bowel continence. Many patients with stage 2 rectal cancer will also need to have a few more months of chemotherapy after they have completed surgery to prevent the occurrence of disease outside of the rectum, such as in the liver or other lymph nodes. Ask your medical oncologist if this will be necessary in your case, as this may depend on factors such as your initial stage or perhaps your response to radiation therapy. If you have been told you have stage 3 rectal cancer, it means that the cancer has spread from the rectum itself into lymph nodes that are nearby. These lymph nodes are sort of like a drainage system for your colon and rectum, where fluids from the tissues are removed and brought back to the heart. Lymph nodes exist throughout your body, and sometimes are a route by which tumor cells can travel. If we find cancer in the lymph nodes, it means that there's a higher risk that cancer may be elsewhere in your body, even if we can't see it on the tests you had initially, like your CAT scan or PET scan. This also implies that we may need to be more aggressive in terms of what types of therapy you get to try to prevent those recurrences. And the main way that is done is with chemotherapy, which can attack small or microscopic deposits of cancer that might have gotten out from the primary tumor site and could be hiding in places such as the liver. Patients with stage 3 rectal cancer generally require what we call multimodality therapy. By multimodality, we mean chemotherapy, radiation therapy, and surgical therapy. And we generally order these with radiation first, often with chemotherapy at the same time as radiation, followed by surgical therapy, and then after recovery from surgery, more chemotherapy. The course of this therapy typically is on the order of 6 to 8 months, depending on things such as how quickly you recover from surgery. If you've been told you have stage 4 rectal cancer, it means that your doctors have found evidence of the cancer's spread or metastasis to other parts of your body, most commonly the liver or lungs or other areas in the abdomen, such as lymph nodes that are not near the rectum. If this is the case, the primary treatment would be chemotherapy, and chemotherapy for rectal cancer is essentially the same as chemotherapy for colon cancer. Rectal cancer can be a difficult and daunting diagnosis. It's understandable that you'll have many questions and often will forget to ask those questions when you've seen your physician. It's good that there are resources such as Guideposts of Strength that are there to help you answer those questions or even understand your disease such that you can ask better questions when you see your doctors.